With the Chinese coronavirus outbreak, travel medicine is right up on the front pages. Are you planning to travel abroad? Our guest on today's Health Talk, an infectious disease specialist, has important advice to help you stay healthy and safe on your next trip. We will introduce you to a physician expert who will discuss the practical aspects of travel medicine. So stay tuned. Health Talk is up next. Hello, I'm Dr. Eric Mazer. Welcome to Health Talk. Today we're going to talk about a very timely topic, travel medicine. My guest is Dr. Nabeela Khan. She's an infectious disease specialist with expertise in travel medicine. Welcome to Health Talk, Nabeela.
Thanks for having me.
So you're a travel medicine expert. We're not going to focus on the coronavirus today, but are more people coming to you about their travel because of concerns of their health than usual because of the coronavirus outbreak?
Yes, they are. They do have a lot of questions about the coronavirus and just travel in general. So a travel medicine consult is a great opportunity for us to devise a health risk assessment about the person who's doing the traveling as well as the trip as well.
And I think you just made an important point. Because anybody can sit on the internet and Google the countries they're going to and see what diseases prophylaxis is recommended for. But you need to assess the patient too. Why is that important?
That's very important because there are underlying health conditions that patients have where certain vaccines or medications might be contraindicated. We do have to review patients' immunizations to make sure that they're up to date with their routine immunizations in addition to the ones that are needed for travel. And not all travel vaccines are required for a particular individual.
So let's start with a lot of people travel today. Who should get a travel medicine consult?
In my opinion, everyone should get a travel medicine consult, especially if the travel is to the developing world. There are many global outbreaks out there that people might not be aware of that your infectious disease physician will be aware of and can advise you appropriately.
And you said this, but just to re-emphasize it, as we get older, I think a lot of adults fall behind on their normal vaccines. This should be an opportunity to catch up, shouldn't it?
That's correct. So in addition to the travel vaccines, we can talk about routine immunizations. One in particular, especially that's pertinent for this season, is the flu vaccine. Oftentimes people do forget about it. And the other one is the tetanus vaccine, which is as important as the other routine vaccines.
So many people say, before we leave the flu vaccine, people say, oh, I got the flu vaccine and I still got the flu. And then we hear, well, it's only 50% effective. But it's still, tell us why it's still important, despite the fact that it's not a perfect vaccine.
It's not a perfect vaccine because it's an educated guess that protects against 4 of the strains, the most common strains, for a particular season. However, when an individual is exposed to the virus, it does attenuate the symptoms. So instead of being sick for a week or so, the duration of illness does get shortened.
Yeah, I think that's such an important point, that you still may get the flu, but you may not die from it.
That is
which
correct.
is a big deal.
Yes.
Because flu is not a trivial illness. Maybe you want to say a few words about the prevalence of influenza deaths every year in this country.
Right. So far this season, we've had 26 million cases of the flu, and we've had approximately 10,000 deaths from the flu. Thinking about that there is a flu vaccine and most of those deaths could have been preventable.
Yeah, it's really, so we underestimate our ability to manage this terribly prevalent cause of death, and I simply am amazed at it. And the CDC has made it very easy for us by recommending basically everybody get the flu vaccine now.
That is correct, yes.
So now let's talk about travel medicine. So you should get your flu vaccine. You should be brought up to date on your tetanus and probably the pertussis if you're going to be getting that, which is the old whooping cough vaccine. We should point out, well, do you want to say anything about autism and vaccines and dispense with that? Because there's still those people out there who are afraid of vaccines, and I don't understand it. I understand what they're saying, but I don't understand the risk they're willing to put them and their families to.
That is correct. The correlation between autism and vaccine has not been clearly defined. And when these diseases are preventable, I think it's still recommended. The CDC as well as the IDSA still recommend routine vaccinations.
Yeah, my understanding is that they found no etiological causal effect between any of the vaccines and autism.
That is correct.
And it's been well studied. It's not like we haven't studied it, it's been well studied. And yet people persist. And then we have people getting measles, which can kill you.
That is correct, yes.
So it's just, so travel medicine, we keep diverging off. Why is it important to get a consultation with a travel medicine expert before you travel?
So as I alluded to earlier, there are a lot of global outbreaks in different parts of the world that a travel medicine specialist will be aware of and can provide pertinent advice in regards to it. But aside from routine vaccinations, there are certain vaccines that are needed before travel. And an ideal opportunity to get those vaccines would be at least 4 weeks prior to the visit. And when it comes to the trip, we do have to look at the season of travel, we have to look at the duration of travel, as well as what planned activities are there, and then determine what vaccines will be necessary. For example, not everybody needs a rabies vaccine if they're not going to be an adventure traveler. However, depending on the location, the Japanese encephalitis virus vaccine might be appropriate. Besides vaccine, the travel medicine consult does consist of talking about traveler's diarrhea, which is the most common cause of illness that travelers acquire, and discussing preventable aspects of it, paying close attention to food and liquid hygiene, as well as at the onset of illness, taking the appropriate antibiotics.
Yeah.
Prophylaxis is no longer recommended. However, treatment, self-treatment is recommended in certain cases.
No, it is very interesting because we cruise frequently, and the thing that people worry about on the cruise ship is norovirus,
Yes.
which is not treatable by antibiotics, and the approach there is meticulous hygiene. That's the way to prevent that. In cruise ships, and I think passengers are increasingly recognize that. But traveler's diarrhea is something different. Oftentimes, I should say.
Yes.
But so, yeah, could you just say a few words about it? Because that's so common, and if you think of it as Montezuma's Revenge or all the other names that we hear, that's often bacterial, isn't it?
That is often bacterial, and the most common strain of bacteria that causes traveler's diarrhea is enterotoxigenic E. coli. The fancy ones that we worry about are Salmonella, Shigella is another bacteria that causes it. There is a lot of resistance in the developing world to Salmonella as well as Shigella and Campylobacter, the other bacteria. So picking the appropriate antibiotic becomes pertinent in that part of the world.
So if you're going to be traveling, what section of the world, are there certain sections? Which sections are the resistant strains most prevalent in, or is it too specialized a question?
So the Indian subcontinent does have a lot of resistance, and the other parts of Asia as well.
So if I were traveling to the Indian subcontinent, you would give me antibiotics to take with me then?
Yes, that is correct.
And the threshold would be if I start to have loose bowel movements, you're to start the right away, or
So
fever or anything? Yeah, what kind of, where do you set the bar in terms of starting the antibiotics?
So if you were having loose bowel movements, if they were frequent, more than 3 loose bowel movements, and if there was fever associated with it, then the recommendation would be for you to go ahead and take the antibiotic as well as an anti-motility agent. However, if the symptoms worsened, the advice is still to seek appropriate medical care at the place.
Okay. And when I think of travel, I always think of malaria. That going to Africa, you're going to Southeast Asia. What do you do about that?
So that is the most common, that is the most serious illness that a traveler can get, which is malaria. And aside from protection, which is using insect repellent, wearing clothing to prevent to cover this unexposed areas, there's chemoprophylaxis that is recommended, which is very specialized depending on the region that the person is traveling to and which other places they'll be going to.
Because some of the malaria are resistant to certain drugs in certain areas, so you really need to know the specifics of what you're doing.
That is correct.
And also, isn't it true that malaria is more common in the rural parts of countries and in the cities? So if you're just going to be in certain cities, you have less risk?
That is correct. So in urban centers, it is less common for you to pick up malaria. However, the risk is not 0%. It is very common in the rural areas.
So this is the nuances of this is why it's really important to have discussions with your doctor.
Yes, so that the schedule of the trip can be planned and all the sites can be discussed beforehand.
I know there are some of the other diseases you look at. I know hepatitis and yellow fever. Can you say a few words about some of these other illnesses?
So hepatitis is a vaccine-preventable illness. There are 2 vaccines available, hepatitis A and B, that we can offer to our patients, and they can be given at an accelerated schedule. Yellow fever is, it's not as common and it's not recommended in all travelers. Only certain parts of Africa as well as certain parts of South America where the yellow fever vaccine will be recommended. There is a national shortage, so only certain facilities
I knew
have
that,
it.
it's pretty limited. And you mentioned the Japanese equine encephalitis. Is that a common recommendation?
So again, it's not a common recommendation. It is very travel specific. So only certain parts of Asia where it will be needed.
And let me, I've traveled recently to Southeast Asia a year ago, and I got, I think, the hepatitis vaccine, and we did malarial prophylaxis and some of the other routine ones. How long are these vaccines good for? Get the hepatitis. If I travel next year, am I going to have the same set of vaccines?
So no,
which
you don't.
Which ones do you need to brush up on or keep current with?
So hepatitis vaccine should provide you lifelong immunity depending on your immune system. The vaccine that will need to be repeated will be, there are actually 2, which is the typhoid vaccine as well as the meningitis vaccine. All the other vaccines you should have lifelong immunity.
So you really do need to see an expert and not look this up on the internet. How about advice? I know in addition to giving vaccines and talking about specific diseases, what do you tell people about risk factor mitigation? How do you keep yourself safe and still have a good time? You don't want to be so afraid that you're afraid to walk out of your hotel room or whatever. What's the balance there?
So we do advise our patients that when it comes to food and liquid hygiene, to be very careful about what you're consuming it in areas that have been accredited, and not consuming local water, for example, because that can contribute to traveler's diarrhea. Using insect repellent if you're going to be in sun-exposed areas where the DEET concentration is at least 30 to 35%, and you're applying it.
What is it in the typical spray, the orange bottle that you could buy in the drugstore?
It varies, so it's very hard to say, but you should really look in the active ingredient to make sure that it's the right percentage. And if it's lower than 30%, that just means that you have to apply it much more frequently, more than 4 to 6 hours in a day with that concentration.
And so those are all good, practical pieces of advice. You do have to watch your water when you travel. And we've run out of time. So thank you very, very much. I'd like to thank our guest today, Dr. Nabeela Khan, for joining us on Health Talk. And thank you for watching. We'd love to hear from you. So remember to share your questions and comments with us by calling us at Community Relations at Advance Health. Our number is 203-852-2250. We'll see you next time.
Well, Thomas, you've got pre-diabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have pre-diabetes. Big time.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
If you're traveling internationally, have you considered what infectious risks are present in certain parts of the world? Have you looked into what immunizations may be recommended to protect your health and well-being? For important and timely information about travel medicine and our health, please stay tuned to this week's Health Talk. We're up next. Hello, I'm Dr. Eric Mazer. Welcome to Health Talk. Today we're going to talk about travel medicine and specifically those immunizations needed for traveling abroad. My guest is Dr. Nabeela Khan, an infectious disease specialist with expertise in travel medicine. Welcome to Health Talk, Nabeela.
Nice to have you.
So, I guess travel medicine is a big part of your practice, or at least a part of your practice. Why should people go see an infectious disease specialist before they're traveling?
I think it's very important for people to see infectious disease specialists so that they can be better prepared for their trip. There are certain vaccines that are indicated prior to a particular trip, and the best time to get them would be at least a month ahead of time.
So it's really, this should be part of your pre-trip planning, like going to getting your hotel reservation.
That is correct, yes.
And we really have a lot of vaccines now available. Mm-hmm. Why don't we all just getting them? Why are they limited to travel to certain parts of the world?
Because there are certain diseases that are more prevalent in certain developing countries, and not all vaccines are recommended for a particular individual. When it comes to, for example, hepatitis A and B vaccines, a lot of people might have already had them, and there's no need for us to repeat it, unless it's clinically indicated, however.
Yeah, aren't most kids getting the hepatitis B today? The hepatitis B vaccines today, right?
That is correct.
But A is more occupational or travel oriented?
Yes, yes, that is correct. And if they've gotten hepatitis B as a child and they have good immune response to it, then there's no need for them to repeat another series.
And their hepatitis C is a bloodborne disease, right? So,
unfortunately,
or sexually, and we don't have a vaccine for it.
Unfortunately, we don't have a vaccine
But we do
yet.
have a cure for it.
That is correct, yes.
So someone comes to you, I know in addition to giving advice about vaccines, you give other advice, especially for, maybe talk a little bit about long plane trips, because that has some risk to people in and of themselves for blood clots in the legs. Can you talk about that?
So yes, so for flights that are at least 8 hours long, there is the risk of developing blood clots in people's extremities. And the best way to prevent that is for you to keep moving your legs. That risk increases if there are underlying health conditions that predispose individuals for developing clots. And for them, they might need a medication, and that's something that should be discussed in a pre-travel consult.
Yeah. Are there any things that everybody should do? I know I've heard get up and walk around every 2 hours. Do support stockings help?
Support stockings will help depending on the risk for having clot formation, but staying hydrated is recommended as well.
And it's very easy to get dehydrated on a plane. Maybe a lot of people don't understand why, but the air is very, very dry.
That is correct.
And then people drink alcohol on top of that, and that's a diuretic. So it's really easy to get dehydrated on a plane.
Yes, so it's very important for you to keep up with your fluid losses and then get a little bit of exercise, keep your legs moving on these long flights to prevent from developing
clots. And I'll speak now as a hematologist. One of the things that predisposes blood to clotting is if it doesn't move, if it just sits in pools. And if you're sitting like this, especially with tight clothing, that would be another thing, wear loose clothing. With tight clothing, you're sitting hunched over, not moving your legs, you're setting them up. You could even do things like just literally standing on your toes in your seat. Just keep those legs moving, pump the blood out of them. Because that can be fatal. People have died on the airplanes just from that, and it's a simple relatively simple preventative.
That is correct.
Now, vaccines. How do you decide what vaccine somebody needs when they come to see you? They
So
say,
you-
I'm going to country XYZ.
So usually we'll go through their schedule of the trip. We'll determine what season they're traveling in, how long they'll be there, and what activities they have planned. That will have an impact on what vaccines are recommended. For
And
example,
how do you know what's going on all over the world as far as infectious diseases?
so there are lots of websites that we do look up. For example, CDC is the major one, where they do keep an eye out on all of the global outbreaks. There is one going on right now. That is the COVID-19 disease that's
known
happening.
as the Chinese coronavirus, before it was renamed COVID-19.
Right. So they do keep those websites updated and alert individuals or infectious disease physicians.
So you have special places where you look, you see what diseases are active, where someone is traveling,
Yes.
and then you do a risk-benefit analysis as to whether the vaccine would be helpful or not.
Yes, that is correct. Yeah.
What are the most common vaccines that the most common travelers-related illnesses that you deal with?
The most common
Not
one.
that people get, but ones that you end up discussing or preventing.
So the one that we always discuss is traveler's diarrhea. It's a very common one that people do acquire either during their travel or when they return. And it can be easily prevented by focusing on food and liquid hygiene, as well as when...
And what does that mean?
That means that eating in established places, staying away from local water, drinking bottled water. If vegetables are being consumed, then consuming vegetables that have hard skin. Same thing applies to fruits.
You mean consuming ones
that
do
have hard skin, so
hard
that they're not using local water to wash the lettuce, for example. Staying away from those sorts of vegetables.
And one thing that I didn't know early on in my medical life, when people think of traveler's diarrhea, they think of loose bowels. It can make you sick with fever. You could be quite sick with traveler's diarrhea. It's more than just the diarrhea. And I just want to point that out to people, that it's not just simply the diarrhea that you have.
That is correct. People do feel nauseated, they do have vomiting, and some even develop bloody diarrhea, at which point they should seek medical help.
And I've heard recommended cooked food only, or fruits and vegetables that you can peel.
That is correct, yes.
And not using local water, but being careful of things like ice. If somebody provides you a glass of ice and that's made with local water and you pour bottled water into it, you're still drinking local water.
That is correct, yes. And even when it comes to brushing your teeth, using bottled water instead of the local water.
Which is really
helps.
not that hard to do, but you've got to remember, because it's funny, having traveled so much, you forget. You walk up to the sink and you just stick your toothbrush under the water, and then you say, oh my God.
That is correct. Yeah.
do something, get a new toothbrush. So you recommend a full evaluation. Let me ask you a couple of questions. Just the coronavirus is out there. It's making people scared about traveling anywhere. You're on close quarters with people on a plane for several hours if you're going to Europe, or more than several if you're going to the Far East. How afraid of that should people be?
So here in the U.S., it's still considered to be very low risk. There have been 15 cases that have been reported in the U.S., and most of them have been imported. So given that, people can still travel to Europe without being concerned for the coronavirus. However, regular infections need to be, people need to be concerned about that.
So we really need to not let this blind us to the regular risks. And how about people with their routine vaccines? How often do you see people not up to date with tetanus or diphtheria or others?
That is very common. People do forget about their tetanus vaccines after childhood. So as adults, they don't get those updated. And the most common one that we see people forget about is the flu vaccine. We are in the midst of a flu season, so that is still a very important vaccine for people to get if they haven't received it so far.
And you had mentioned at another time some of the mortality and morbidity statistics with influenza. Can you just tell our viewers how how many people in this country are getting sick and how many people are dying of flu this year?
So we are having a pretty bad flu season this year. So far, 26 million cases have been reported to the CDC.
That's almost 10% of the, and that's probably underreported as well.
That is correct. And we've had 10,000 deaths approximately so far this season, and we're in the middle of the season. The season's not over yet.
10,000 deaths, you know, just for folks at home, keeping that in perspective of 0 deaths with coronavirus. Now, we know we've had them in China, but they're all pretty geographically isolated, not isolated, but limited. And let me just, you know, just going back to flu, but flu could be a fatal illness.
That is correct, yes.
So flu vaccine is essential for all of us, and even if you're not traveling. Is it too late to get the flu vaccine? It's February now. Is it too late to get the flu vaccine for the average person?
It's never too late to get the flu vaccine. If someone still hasn't received it, they can still see their primary care providers and get a vaccine.
And I know they're changing. There's some discussion I saw recently about work going on for a flu vaccine for the core elements of the virus that may permanently immunize us against the flu rather than have to guess the strain every year. Do you know much about that? Is that something that's realistic for the near future, or is that still pretty far out?
I would say that it's still pretty far out. The CDC does make an educated guess every year in regards to the flu vaccine, and it does provide us protection against most 3 or 4 strains of the virus, 2 of the flu A virus and then 2 of the flu B viruses.
And you may still get the flu if you have the vaccine, but it's likely to be less severe.
That is correct.
So you still can save your life even if you've gotten the flu.
That is correct, yes.
And again, flu is, people underestimate. They don't realize that flu can be a fatal illness. Even though, just jumping around a little bit, back to the coronavirus, do we know, one of the things that seems very unclear to me at this point is the risk of person-to-person spread. I mean, I know that there was this tremendous outbreak in Wuhan. We don't quite know where it came from, but again, it seems like once we get people and we get them quarantined, don't seem like a lot more pop up. Is that true? Do we know how risky it is on a person-to-person level? Do we know how frequently asymptomatic people are spreading the virus? Or we still need to develop that information?
So we're still learning about the coronavirus so far. There have been cases of person-to-person transmission, and most of them have occurred when people were symptomatic. There was
one was a
couple
husband
of
and wife,
cases
right?
where
They were
there was
close.
asymptomatic transmission. Again, still a lot is not known about the virus, and it is still recommended that when you're feeling sick, you're using hand hygiene, covering your coughs and sneezes, getting rid of the tissues, and using disinfectants to clean hard surfaces, and staying
We've got 30
home.
seconds left, and this is a general question, but I think, how about washing your hands versus some of the alcohol wipes? Do you recommend one versus the other?
So when using soap and water, you should use it for 20 seconds. And for hand sanitizer, if your hands are not visibly soiled, that can be used as long as the alcohol content is 60% or higher.
And you should wipe that through your hands until it dries, my understanding, for it to be most effective. Is that effective against viruses too?
That is effective against viruses and certain bacteria.
So there's really no excuse for not keeping your hands clean. And sneeze into your, don't do this. Sneeze this way. I learned that finally. And unfortunately, we've run out of time. I want to thank our guest, Dr. Nabeela Khan, for joining me on Health Talk today. And thank you for watching. We'd love to hear from you, so remember to share your questions and comments by calling us at Community Relations at Nuvance Health, 203-852-2250. We'll see you next time.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. and that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke, F-A-S-T, fast.